Bismillahirrahmanirrahim. Quote of the day. Opportunity is missed by most people because it is dressed in overalls and looks like work. Thomas Edison. I am Dr. Hussain Mehmood, PGI Community Medicine. Today I am presenting health policy and its analysis under kind supervision of Professor Dr. Saira Afzal. Learning outlines. Health policy, public health and health policy, policy process, health policy triangle, practical application, recent updates, and MCQs. Learning outcome. At the end of this presentation, participant will be able to describe health policy analysis triangle, and its practical application. What is health policy? Policies are general statements based on human aspirations, set of values, commitment, assessment of current situation, and an image of desired future situation. What is difference between public policies and health policies? Public policy Public policies authoritative decision made in legislative, executive or judicial branch government intended to direct or influence the action, behaviors or decision of others. Health policies aggregate principle stated or unstated that characterize the distribution of resources, services, and political influence. Health policy impact directly on the health of population. WHO definition. According to WHO definition, health policy can be defined as the decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. According to the World Health Organization, health policy can achieve several things. It defines a vision for the future. It outlines priorities and the expected roles of different groups. It builds conscious and informed peoples. Health policy development landmarks. The first landmark in the development of health policy was the worldwide adoption of the goal of health for all by 2000 AD. And the second landmark was Alma Ata Declaration in 1978, calling all government to develop and implement primary health care strategies to attain the targets of health for all, and more recently SDGs 2030, health for all. All people in all countries should have to least such a level of health that they are capable of doing work productively and participate actively in social life of community. Health is brought within the reach of everyone. It is holistic concept of efforts in field of industry, agriculture, housing, communication, and as much as medicine and public health. Spectrum of area covered by health policy: financing and delivery of health care, quality of care, access to care, health equity, categories of health policy, global health policy, mental health policy, pharmaceutical health policy, policies related to public health, vaccination policy, tobacco control policy, breastfeeding promotion policy. According to the Mosby definition of health policy, statement of decision regarding goal in healthcare and a plan for achieving that goal. For example, to prevent an epidemic, program for inoculating a population is developed and implemented. Health policy cycle. Health policy cycle first part is agenda setting and policy formulation. Next is decision making, and next is policy implementation and policy evaluation. First is agenda settings. Issue becomes significant and draws the attention of policy makers. Health needs are measured, self-report, health status indicators, biomedical measures of health status, geographic variations. Next is policy formulation. The various stakeholders like healthcare teams, hospitals, and governments are involved in the formulation of policy. Next is decision making. In this stage, solution is chosen that how the stakeholders decide to approach an issue. Then we will discuss different management level of health system. As identified in the aforementioned definition, healthcare management does not refer solely to one level of practice, but it is quite a broad process which occurs in different levels instead. Holders and Remedium 2012 refer to a model adopted by autumn 1999 who categorize management activities at the macro, meso, and micro level. In macro level of health system management, health system policy level, and national health authorities. In meso level of health system management include health services, network hospitals, facility managers. In micro level of health system management include clinical management, healthcare providers involved in drug provision of clinical care. Then macro level policies implemented by government with the help of national health ministry for achieving national health goals. For example, national program of immunization. In meso level, management of health services and facilities for the population, health needs and expectations. For example, provision of vaccination at all health facility centers. In micro level, direct provision of clinical care. For example, child get vaccinated. Health policy analysis. According to the Gilson et al., health policy analysis is a multiple disciplinary approach to public policy that aims to explain the interaction between institutions, interest, and ideas in policy process. According to the Bush et al., analysis means separating a problem into its constituent part so as to better understand its whole. Analysis is an application of knowledge, represents the primary contributions of health policy analysis to governmental decision making. What is the 5E approach to policy analysis? The first is the phases include, second engage, third is explore, fourth is explain, and fifth is elaborate and evaluate. Health policy triangle. Health policy triangle is developed by the Walt and Gallison in 1994. Four elements of policy analysis are context, why need this policy? Second is content, what is the policy mainly about? Third is the process, how was the policy brought forward and implemented? Fourth is the actors who participate in influences, formulation and implementation of the policy. The policy triangle include content, ideas for policy, types and scale for policy. Actors who makes and influence decision, power and how, whose interest, whose ideas. Processes, agenda setting, policy formulation and implementation. Context, stimulational, structural, cultural and environmental. Context, the socio-political, cultural and health system context within which the child and adolescent mental health policy was developed. Content, the objective, values, vision, service, model, guideline and implementation plans for child and adolescent mental health service outlined. In actors, the range and characteristics of participants, individual, groups or organizations in the policy development process, including their roles, relationship, interest, agendas, and expertise in child and adolescent mental health. Then the process followed to consult with key stakeholders across government sectors, health, social care, and education, non-government health sectors, and other relevant civil organizations. Health-related program in Pakistan, National Program for Family Planning and MNCH, Primary Health Care, Expanded Program of Immunization, National AIDS Control Program, Malaria and Dengue Control Program, National Nutrition Program, Hepatitis Program, and COVID vaccination. Challenges in developed countries, weak regulation and monitoring system, lack of purchasing power, quality of services delivered, influences of political system, reliance of external donor funds, objective of national health policies, achieve a acceptable standard of improved health, increase access to public health system, ensure equitable access to health care, create new health infrastructure in areas deficient, upgrade existing health infrastructure, promote public-private partnership, suggest ways to increase investment in health, promote effective monitoring and evaluation of current policies and implementation at district level. Forms of policy analysis. There are two forms of policy analysis. First is prospective and second is retrospective. First is prospective. Prospective policy analysis involve the production and transformation of information before policy action. And retrospective policy, this form of analysis involves the production and transformation of information after policies have been implemented. Prospective analysis. It provides quantitative and qualitative information on which we make future decisions. It emphasizes on obtaining information about goals and objectives of policies. Retrospective analysis. It includes the studies, the data from policies that already have been put in effect. It is usually known as research. It shows what does not work at the macro level, places primary emphasis on the result of action or implementation rather than the process. Why policy analysis is necessary? Policy analysis is necessary for health reforms, past successes and failures, techniques and tools to study the characteristic of established policies, how the policies came to be and what are their consequences, assess the outcome of health policies or the impact of policy on people. Policy analysis illustrates the needs for interventions. Think seriously about the problems. And recent updates. This article is published in 2020. Health policy analysis in Eastern Mediterranean region using a health policy triangle framework, historical and ethical insight from a systematic review. Paper aimed to collect systematically the study using health policy triangle framework in doing analysis in one of the health policy issues in Eastern Mediterranean region organization. Method to conduct our literature search: ISI, Web of Science, PubMed, Medline, Embase, the Cochrane Library, Global Health Database, Scopes, as well as Google Scholar from 2003 up to June 2020 were systematically mined to evaluate the methodological quality of the included studies. The critical appraisal skills program checklist was used. Result: we selected 30 studies conducted between 2011 and 2020. According to the findings of these studies in the Eastern Mediterranean region, organization region, and the role of evidence-based research is policy making has been repeatedly emphasized, but is used in health program decision making has been limited, and health research system in Eastern Mediterranean region organization are still under scrutiny. There is still a gap between evidence-based research in health system and its use in policy making. Discussion. Based on the present systematic review, studies based on policy analysis should focus on all the elements of health policies and provide evidence to inform decisions that can strengthen health systems, improve health, and improve existing inequalities. Then MCQs. First MCQs. The fourth National Immunization Campaign for Year 2021 reached across the nation in December to vaccinate more than 40 million children under 5 in 156 districts. During this campaign, several social and cultural problems were reported. According to the health policy triangles, these problem lies in which section? Content, context, actors, and process.
A.
No, it's B, context. MCQs number 2, the country designed policy for vaccination and its impact on population measured after 2 years. What is the type of this analysis? Prospective analysis, retrospective analysis, interactive analysis, and health policy analysis.
D.
It's B, retrospective analysis. MCQ 3. Which means of influencing public policy is generally seen as ineffective by interest group and those who analyze them? Lobbying a cabinet minister, using the legal system, lobbying members of parliament, taking their case to the public, lobbying central agencies. Anyone? It's C. Lobbying members of parliament. Government has formulated a policy and increased the tax amount of cigarette to decrease the purchasing power of customer. At which level of policy works? Macro level, meso level, micro level, and primary level. It's A, macro level. During which part of public policy cycle does the government explore potential policy response? Agenda settings, policy formulations, policy implementation, decision making.
B.
It's B, policy formulation. Most research conducted recently found that rising cigarette price through increased taxes is a highly effective measure for reducing smoking among youth, young adults,
C.
and person of low socioeconomic status at government level. At which level of this policy work? Meso level, macro level, micro level, and primary.
C.
It's B, macro level. MCQ number 7, the current scenario of COVID-19, the SOPs given by government are not followed in many places. Which stage of policy process cannot fulfilled? Agenda setting, policy formulation, policy implementation, and policy evaluation.
D.
Implementation. C.
Yes, it's C, policy implementation. MCQ 8. When relevant ministers hold a news conference to announce the government's intent to introduce a new policy, what is known as decision making, policy evaluation, policy implementation, and policy change.
B.
It's C.
It's,
Policy implementation.
yes, it's C, policy implementation. MCQs number 9. When health managers keep continuous oversight of activities to ensure that they are proceeding according to plan, so he is doing monitoring, recording, planning, and evaluation.
A.
C.
Monitoring.
Yes, it's a monitoring. MCQs number 10. Sequence of activities designed to implement policies and accomplish objectives is called plan, goal, schedule, and program.
Goal. B.
It's D, program. This is key for the MCQs, and this is our YouTube channel link. And thank you so much.
Thank you,